Hi, my name is Jason Lowenstein, and I'm an orthopedic spine surgeon in practice in Morristown, New Jersey. I was born in New York, but grew up in New Jersey. I did my undergraduate degree at the University of Pennsylvania. I went to medical school at the University of Pittsburgh, and then I went and did my residency in orthopedic surgery at Columbia University Medical Center. I then went down to Atlanta and did a fellowship in spine surgery at the Emory University Hospital and focused on adult and pediatric spine and scoliosis surgery. I focus on the treatment of children and adults that have spinal deformities such as scoliosis, kyphosis, and spondylolisthesis. My goal is to try to correct their deformities and try to straighten their spine as best I can to try to help patients get back to their normal activities of daily living. Many of my patients have also had previous spine surgery for scoliosis or spinal deformity and have additional problems later on. I tend to see these patients and try to work up exactly what the etiology is of these further problems and then try to help treat them to again try to get them to maximally correct their deformity, to get them to stand up straight, to get them to be able to go back to their normal activities with as little pain and as much function as possible. Revision spine surgery presents unique challenges because patients have already had surgery and there's often embedded scar tissue associated with the previous surgical approaches. So it makes unique challenges for us as surgeons to try to fix those problems. These patients oftentimes come in with neurological disorders such as weakness or foot drop. They oftentimes have things called flat backs where they're unable to stand up straight, or additional disorders where they either stand up leaning forward or to the side. Our goal is to try to maximally correct that so they stand up straight and they can get back to their normal activities of daily living with as little pain as possible and as much function as possible. Patients can get diagnosed with scoliosis at any age. It can happen to children, it can happen to adults. At any age, it's a scary and confusing situation. When I see patients who have a spinal deformity, my goal is to try to help them identify what's causing their problem and then come up with a treatment plan to help maximally correct their deformity and treat them in a way that helps them reach their individual goals. When formulating a treatment plan for patients who have scoliosis or spinal deformity, the goal is always to do the least amount of surgery possible to fix the deformity and allow the patient to get back to their normal activities of daily living. Whenever possible, I'll utilize minimally invasive techniques to try to fix their deformity, to get them back to their normal activities as quickly as possible.